The purpose of the Fistula Care Plus Safe Surgery Toolkit is to provide an adaptable system of quality assurance tools and safety checklist-based tools. There's an amazing global surgery community of practice that is based on the concept of safety, keeping the patients safe. It was originally started within the World Health Assembly and World Health Organization back in 1980. This community is predicated on safety, and so any facility that is doing surgery can use this toolkit. We've designed it specifically for fistula, prolapse, and incontinence because that's what we do. But the checklists themselves are universal and can be used for any type of surgery. What they do is allow you to do the same thing, the same way, every time, to keep the patient safe. From admission through the entire course of care, especially in the operating theater, which is a very high stakes environment for the patient and for the staff.
What the client tracker is looking at is several aspects. One, a proper data collection item about the patient and contactable information, so you can track the patient back to wherever they live, because you have to bear in mind that most of the hospitals performing fistula surgery are really the centers of excellence. So patients come from many miles away, sometimes thousands of miles away, to access care. So the starting point is the improvement in personal data collection for all the patients. The second point is to ensure that once the patient is allocated to the system, that they don't get lost within the system. And then the third aspect is that once the patient has completed care within the facility and have gone back home, there is a way to contact the environment from which they come from, be it the local health clinic, the local doctors, and so on, to keep an eye out on what's happening to this particular patient. So it's extending the scope of care from outside just the facility to the entire patient journey. The surgical candidate for admission to hospital checklist is really looking at ensuring that the patient is fully registered, so all the details are present, and that the patient is moved through the system quite quickly. So they are seen within an outpatient facility. They are then advised of the condition that they have, so a diagnosis is reached. So if they need investigations and checks, this is all done. But more importantly, to start preparing them for the designated surgical procedure. Now, one of the problems we have in under-resourced settings is many of our patients have often not had treatment for common conditions, including malaria, for instance. And obviously, if they're unwell, they cannot have surgery because of the risks that are associated with infections and surgery. Then identifying whether they are clinically, hematologically stable for the procedure, so that ensure they're not anemic, make sure they're not nutritionally deficient. So this is the importance of this preparedness list, because until those points are all checked, they really should not be proceeding to surgery at all.
The pre-op clearance enables us to, one, assure that the patient we are taking to theater is the same one that we saw originally and on whom we had made a specific diagnosis. It also helps us to rethink and be affirmative about what we have found, what we have thought of, and what we intend to do for the patient. It also helps us, for instance, to ensure that in the case of fistula patient requires surgery, for instance, that the surgery we plan is the one we intend to do on the patient, and that we still maintain that that is what must be done for that patient, and that the patient has signed and accepted with a consent that that procedure should be carried out. And sometimes, if necessary, that the point of the surgery is already been identified and marked to guide the surgeons in theater, and that all the precautionary measures to ensure the safety of the client has been maintained before we take the patient to.
The patient transport checklist is important because they are now usually dressed in their gown to go to theatre. They usually are in an environment such as a ward or perhaps in a pre-admission facility where we need to now check their name once again, check their date of birth in particular because many people may have the same name, and to make absolutely certain that the patient is now ready, consented and counselled appropriately for the procedure and they wish to proceed. Once that is all confirmed, and this is usually done by the nursing team and administrative team in this area, the patient is then transferred to theatre. Once they have completed all their checklists and the patient has now proceeded to theatre, this piece of paper, as it were, or this aspect of the checklist needs to usually be handed over to the theatre team receiving the patient. So there's a theatre reception group that will then say, yes, we have checked everything, yes, this is the correct patient for the correct operation at the correct time.
Once anesthesia is underway, before any surgery is actually done, there's a timeout where the entire team talks to each other. Make sure that we have the right patient, that we have the right medications and supplies around, including blood, that we understand if she needs antibiotics, that she's gotten those antibiotics already, what we're going to do, whether we anticipate it to be a simple surgery or a complicated surgery, how long we think it might take, etc.
We identify ourselves in theatre, we announce and mention our names and say precisely what our roles will be, and we all agree. And if there's any dissenting voice, that should be resolved before the procedure commences.
It's empowering the patient in contributing to their care, but more importantly, the team can now stop and say, well, actually, you know, this has not been completed appropriately and we don't think this should go ahead. So now the team feels they have ownership of the situation as much as the consultant surgeon does. In other settings when this started, there was a sense of loss of power by many of the surgeons until they realized actually from a safety perspective it helped them because their decisions could be contested, so they needed to be very clear about the decision they were taking on a particular patient and to ensure that the patient was truly prepared and ready for the surgery.
The Sentinel Events Quality Assurance Tracker is a really helpful tool for the individual staff members and clinicians and also for the facility itself. It functions at several levels. The basic level is to identify a facility that's having weaknesses in their system, that's creating complications in patient care. And if it's left unchecked, we may actually end up with the ultimate complication, which is a death.
The most important thing about the Sentinel Events Tracker is to identify the problem and look at possible solutions for the future. It's not about blame. And that's very key to this. The minute you start to blame anybody within this environment, you lose the will to pursue change, and change for the better.
To move from name and blame to systems analysis is a very healthy and happy transformation, and the Sentinel Events system allows for that.
The operation report is important for the post-operative care of the patient. Not just the immediate post-operative care, but long-term planning. The surgeons or the team members need to put down precisely what they found, what they did, what they did in response to what they found, and what the implications of what they did will be for our continued care, including long-term care and long-term health situation of the patient. And so that there can be information to inform continuum of care, even if the patient relocates or if someone else were to be seeing that patient, will have adequate and full comprehensive reports to base subsequent management upon.
It is good practice and good principle to see your patients every day after surgery, and indeed on the day after surgery as well. The aim of the round is to ensure that all the parameters are checked, such as the heart rate, the respiratory rate, the blood pressure, to ensure there's no undue bleeding, to ensure that the patient is passing good amounts of urine. So there's certain markers of good recovery, and you need to be able to show that those markers are being met. All of this can't happen without the patient, so simply speaking to the patient, asking them how they are keeping and how they are, ask them if they're feeling any discomfort or pain, explain to them the operation, because sometimes they don't know what's happened to them, and you need to explain that in very simple and clear language, and most importantly is to reassure them that the operation, to your knowledge, has been successful, but we're going to wait and see how successful it is in the long term. And because a lot of patients are extremely anxious, they're often quite young, so they need that reassurance. The discharge summary is usually a simple document. It states the diagnosis, and it states the operation, and it states whether there were any complications. But more importantly, it states what needs to happen in the local environment the patient is going back to. Basically, it informs the home team of what the patient's needs are and for how long. This perhaps, from the patient's perspective, is the most important document of all. The patient and her family often have questions that need to be answered. They may seem simple or sometimes meaningless to the team, but actually it's very important to them. And it's very important you have that time with the patient. You need to inform them of what's happened to them. You need to also explain to them what situations may arise in the recovery period long term. They need to be informed of what activities they can do, because certain activities can impact on recovery. So all of these factors, which seem minor things to us as a surgical team, actually are critical to the well-being of the patient, but more importantly, to the recovery. This is complex surgery, and the recovery phase is as important as the day in theatre.
Checklists are important for every clinician, every care provider to use, not only for fistula alone. And I'm happy to continue to use it and to recommend the use of checklists for every clinician that may want to maintain integrity, the Hippocratic Oath, to ensure ethical practices, that there's no undue danger to which the client is exposed, and to, of course, provide the highest standard of care for all the patients that we look after.
If you look at the data, you can't argue with the data. It saves patients' lives, and it helps teams work well together. It forces us to just do what we need to keep that patient safe every single time, the same way for every patient.
The pressure and anxiety related to the safety being maintained for the patient is supported across the whole group, and so therefore you do not feel that you are, if anything what goes wrong, that it's perhaps because you missed something. Actually, it's a team effort and it's team working together.
This toolkit is much more than just a toolkit. It's going to help you with research, it's going to help you talk to ministries, it's going to help you show up to meetings at the local, national, and global level with real, powerful information that everyone will want to hear. It's going to help you further your career. It's going to open your eyes to an entire realm of possibilities that you may not have understood before. It's going to make you a better team player. You're going to enjoy your work more, and you're going to have much happier patients.